This is Dr. Tawari.
And this is Dr. Kochak.
And you're listening to the
Best Podcast Ever.
Broadcasting from Columbus, Ohio, we'll be talking about plastic surgery procedures focusing on only the breast.
Ranging from breast reconstruction to breast enhancement and reduction, we'll cover everything you ever wanted to know about the breast.
Good morning, everybody. Welcome back to the Best Podcast Ever. I'm Dr. Tawari.
And I'm Dr. Kochak, and we're actually really excited to have our guest today. Her name is Patti Carey, and we actually know her very well because she's one of our former and ongoing patients, I guess. Once you're part of the practice, I think you're in it forever, right, at that point. So she's been kind enough to take some time today to be able to talk to us. Patti's really interesting because I think her story is very interesting, but also she's been very active in some of the national organizations. And she's also been a person who's been very quick to get back to activity and very involved in some activities that she's gone through. So we're going to fire this up and talk a lot about these things as we go. Patti, tell us a little bit about you. I mean, you've got quite a history as far as your breast cancer and goes and other things. So tell us about that.
Yeah, so I was first diagnosed in 2002. I found the lump myself. After I had my first child, I had some breast issues, and I had a OBGYN scare me and say, hey, you better be doing, a monthly breast check because, you could be somebody someday that winds up with breast cancer and you wouldn't know it. So, and I did have a lump right after I had my first child, and it was mainly an infection in the duct. So anyway, long story short, I wound up, doing the monthly breast check, found, a couple of times I found lumps, and then I found this lump and I went in and had it checked out. At the same time, while I was dealing with this, my dad was in hospice for prostate cancer.
Oh boy.
So he's 66 years old. So I had a lot to get done and I was helping out with him. So I went in and, they said, oh, I don't think it's anything, but, let's do a biopsy. So
you picked up the lump on your own. So this was on self-exam.
Yeah, on self-exam. Yeah. And then I went in, had the biopsy, and actually, I told them, I said, hey, this is my situation. You need to call me. They called me at home and, I was told, hey, you got cancer. And I mean, they were like, at first they were like, oh, we're 99% sure this is nothing. So, when you get that phone call, you're kind of blown out of the water to hear those three little words, you've got cancer.
How old were you?
I was 43 going on 44.
Got it.
So very young.
Yeah, I was young. And I had an 8.5-year-old and a 12-year-old, kids at the time. And so, I got that phone call. And so I wound up going in and I did, I thought about it. I went and heard all, different stories. Should I get a lumpectomy, mastectomy? And I decided to go with a lumpectomy. And then I did chemo, radiation. I was ER positive, PR positive, HER2 positive. At the time when I got diagnosed in 2002, Herceptin was not available unless you were metastatic or you had a lymph node. I had no lymph node involvement, fortunately. So I, did not get Herceptin. So I did adjuvant therapy after that. And then I didn't do genetic testing at the time. And I waited a couple years, did genetic testing 8 years ago, and I found out I'm CHEK2 positive. So I decided back then that if I had the first time, regardless if it was good or bad, if I had any issues, I was going to do a double mastectomy with reconstruction.
Patti, because we had a really good discussion with Lindsay Byrne yesterday, who's a genetic counselor. And so we talked a lot about the different mutations. So you were diagnosed in 2002, and then what year did you get the CHEK2 diagnosis?
I think it was 2008 or 9 that I went in.
Yeah. And this is something that we talked a little bit about yesterday, that we've had, a fair number of patients, and you're a really good example of this, before some of the genetic testing became more sort of mainstream, more kind of regular. We've had a lot of patients who had a diagnosis in, let's say, at the early 2000s, and then a genetic diagnosis later in their life because the testing changed. So that's interesting that that's exactly what had happened with you.
Yeah, because when they first did the first round of genetic testing, I didn't come up with the BRCA, gene. And obviously with my dad, my dad did eventually pass away 9 months after I was diagnosed.
Oh, sorry to hear that.
Well, that's a whole different story, but, that was one of the reasons, they had suggested I do genetic testing at the time, but with my kids and my dad, I was just like, I have enough on my plate physically, mentally, and emotionally. I don't want to have to deal with.
I wonder if the check gene would have even been on the profile at that time.
No, it would not have.
Yeah.
I mean, they were just starting to develop that. It probably would have changed what I would have done if I would have been check 2 to start, and I knew that. I probably would have gone right with the double mastectomy with reconstruction.
Again, we talked a lot about this yesterday, how, the future of a lot of medicine, certainly breast cancer, is going to be the genetics piece. And just to hear you say that it would have changed your decision process had you known that, I think that really speaks volumes to how powerful some of the genetic testing is.
I almost wish we could get Lindsay Byrne right on this podcast right now.
Yeah.
Because, it's almost...
Well, maybe we'll have to do one with Lindsay Byrne. And, part of one of the reasons I was really hesitant to do the genetic testing was because I had family members that were saying, I don't want to know, I don't want to know, I don't want to live my life, trying to figure out if I'm going to get cancer or not, and quite honestly, I felt like it was Pandora's box. I have, even though I have 2 sons, I was looking at it from my perspective. It not only affects me, it affects my husband, it affects my kids. So I think you really have to be ready to deal with the results. And actually, my oncologist, and I don't know if I should name him or not, yeah, Dr. Corliss had said to me, don't do the testing unless you're going to follow through with the recommendations. And I said, well, what would your recommendation be? And he said, well, I would recommend, aggressive screening for a while, or you can go right out of the gate and do a double mastectomy. So we decided in my situation that I was going to do the aggressive screening at first. And that's what I was doing from 2008. From the time I got diagnosed with check 2, I was doing MRI, and then 6 months later doing a mammogram. And obviously, of course, I was still doing self-checks.
So tell us a little bit about that, Patti, because we always talk to patients in these high-risk clinics. And I think the process of going through this imaging is a tough one every 6 months.
It is.
Tell us a little bit about that.
It actually has changed a lot since the very first one. The very first MRI I got was a little uncomfortable because it wasn't, they didn't change a lot of things. You're in an MRI tube for 45 minutes. You can't move. Does it create stress? A little bit when you have to lay in the tube for 45 minutes.
I've had an MRI before, and I'll tell you what, I don't ever want one again. Those things have you had one, Dr. Tawari?
I don't think I've ever had an MRI.
Oh, you'd remember. It's not something you forget quick.
Well, and the thing is, when you're doing one for breast cancer, you're laying on your stomach face down. And when I first did it, they didn't have a lot of the things. Now they were a drop down and all of that. And so it was very uncomfortable. And then as years went by, it got more comfortable. And so, that's what basically I was doing. And then I was going in and getting followed up by a mammogram every 6 months.
So every 6 months you had to get some form of imaging.
Right. Some form of imaging. And now when I look back on it, it's like, well, maybe I should have done the double mastectomy right away when I found out I was check 2. And then, again, the check 2 information, they're coming out with more and more things related to check.
It's got to be stressful every 6 months. You're waiting for that MRI result. You're waiting for that mammogram result. I mean, I can only imagine how stressful that is.
It is very stressful. And then you're in this tube, even if you're not claustrophobic, you're in this tube for 45 minutes trying to, relax. And I used to just have them crank the headphones. And actually, one of the ways I got through it was, believe it or not, you guys will probably laugh, is every time the ping went, I was counting tennis ball, like I was pretending like I was hitting a tennis racket with the ball against the machine. You got to do something to get your mind off of it. And then you have the stress of waiting. And, for me, I had already been through, a breast cancer diagnosis once. So, your anxiety levels are a little high during that time period until you get, you hear back.
So how long did you go with just monitoring?
I think it was pretty close to 4 or 5 years.
Wow.
Yeah. Actually, so I think I said I got tested in 2008 or 9.
Ish, yeah.
So until almost, it was at least 5 or 6 years.
And that's when we met you, right?
Well, yeah, you guys met me the wrong way. The way this happened is I went in because of my blood disorder, the essential thrombocytosis. which is kind of like the way it's been explained to me is like a chronic leukemia. It's not like ACL or any of that. It's just something I have high platelets and they're not functional. So I can either bleed on you, which you guys very well know, or I can clot very easily. So I'm on medication to control that. So I went in, and because of that, we just decided, let's get the MRI done. And then I had a tiny, tiny pin size area that they said, oh, it looks like atypical cells. Why don't we wait? And I'm like, no, I made up my mind when I did genetic testing that the first time, good or bad, I'm going to do. So I think for me, the decision wasn't as bad wasn't as stressful because I had already made up my mind before I had the problem. So some of this, my take on this is some of this is you have to be proactive yourself and decide what is best for you ahead of time if you're going to do genetic testing.
And so that biopsy is what triggered this. So you didn't have a cancer pop up again, but it was an atypical ductal hyperplasia that came up.
Right. And then you guys obviously did my surgery. And then, I got the phone call from my doctor Dr. Lilly saying, oh, by the way, and actually the right, so the first cancer was on the right side and this one was on the left side. And ironically, it was not in the same spot because they always say sometimes you'll get, cancer in the same spot. It was in a different spot. And he said that I had, they had that little area that was atypical cells were definitely cancer cells. It was, stage 0 in situ. So,
Wow.
I kind of felt like I escaped a big bullet again because of the fact that I had already done chemotherapy, radiation, and all of that. And if it would have been a second diagnosis, that I would have had to do chemo and radiation. And if I would have waited, and I did it right in the middle of tax season, I'm a tax accountant. So I basically said, no, I'm doing this. And so if I would have put it off, I don't know where I would have been.
Fascinating. That is amazing. It's serendipitous that you kind of pulled the trigger and they found something in there afterwards. That's, great you did.
Yeah. I mean, it's not easy to, a couple times I questioned myself, like, why am I jumping the gun? Maybe I should just wait 6 months. But, in hindsight, I'm glad I did it.
Yeah, I think that's something that I've never really asked a patient. I mean, you're a busy professional. You've got you've got your occupation and you're dealing with this diagnosis. How do you meld those two? How do you decide, okay, I got to put my job on hold and I got to focus on my health? It's obviously what we all have to do when we get sick, but it's a hard thing to do.
I'm very fortunate in my position that, even though I was a tax accountant, I worked very full-time during tax season, and outside of tax season, I only worked when my clients needed me or in the fall. A lot of young women that I talk to, they're single and they have these careers going and then breast cancer kind of gets in the way. And then, your job, they have to worry about keeping their job because they need their health insurance and, they have no other way of surviving. So, it's really tough.
But you have managed to do brilliantly through all of this. I mean, that's one of the most amazing things about you. And this is why we're so excited to get you on this, is because, you're one of the fittest people I think I've ever seen. And you, through all of this stuff, have been very active, right? Every time I talk to you, you talk about being very active. You just tell us what kind of stuff you're into.
Yeah, as you know, I really like to cycle, and I have cycled for YSC, the Young Survival Coalition, in their bike ride. If you would have asked me years and years ago, they had asked me to do that bike ride, and I was like, there's no way you're getting me on a bike to ride 200 miles. So, and I've done it 8 times, and one year I actually did it back to back. And that was actually, I think it was like 2012 that I actually did back to back rides. So I did the East Coast, and then 3 weeks later, I went out to the West Coast and did the ride. And then, I play a little tennis. I'm getting into golf now that I'm getting older, because I know at some point that the knees are going to go. I go to the gym and I weight train. I just try and do something every day, even.
That's where Patty and I see each other. We go to the same gym.
That's right.
Couple times I saw him after surgery and I was like, oh, Dr. Torres in here. So I figured that I'm not doing anything I'm not supposed to. And I think
he'll let Dr. Kochak know right away.
Yes, I know. I think you guys knew that you had to kind of keep me saddled because I kept coming in and saying, when can I do this? When can I do this? When can I do this? So, I just like to be active. For me, I am a person that has high energy. And so this is my way of kind of getting a lot of stress out. And I've actually taken up yoga in the last 2 years, which that was really difficult for me because I'm one of those exercisers that likes to be on the move, and then to put myself on a mat for 45 minutes. The first couple times I was like, well, what's next? What's next?
Are there yoga moves or activities that you find that you have trouble with after the reconstruction, or the things that you have to work around?
I would say this to anybody: lumpectomy, because the first time I had the lumpectomy, and I was really into playing a lot of tennis back then, and that took a while. You just have to kind of forget where you were in whatever sport you were in, and just learn to take baby steps. Like for me in yoga, it took me a little bit, on the upper body moves to get the strength back and not feel uncomfortable. But it wasn't anything that, as soon as I would feel anything, I'd stop doing that move and just maybe, go into child's pose or something. So I think you have to go into exercise after this type of surgery with, low expectations. And I can remember sitting on the couch, which was really hard for me after having been so active, trying to figure out, okay, what am I going to do? It was March. It was kind of cold out. So I think after the first week, I started just walking laps inside the house. Just every once in a while, I would get up and just start walking, or, that's how I kind of started back into trying to get back into shape. Was I would just go out for a walk, and I would just, have little goals like, oh, today I'm just going to walk down to the end of the driveway and back. And then, or like, hey, I'm going to make it down to the end of the street.
But now that you're several years out, do you feel like you're limited in your physical activities in any way with your reconstruction and having had the mastectomies?
No, I really don't. And I have to give that credit to you guys, because you really made me, because I know I kept getting frustrated when I'd come in and say, when can I do this? When can I do this?
I'm remembering this now, actually.
Yeah, and especially because one of them, I think, after the double mastectomy in July, I had the expanders put in, and my husband and I were going to Scotland in September, and I kept saying, well, I have to be able to golf. I'm going to Scotland.
I remember that conversation. I think we even had that at the gym. We had the whole conversation.
I know. And I
was she doing good cop, bad cop with us, like the parents?
I think she's trying to get me to say.
If Dr. K said no, maybe Dr. T will say yes.
Yeah, I think you guys were tag teaming it on me. So, and I remember going in, and you would say, oh, yeah, well, maybe a few more weeks. And I'd go back, and you'd say, oh, yeah. Then I remember the compromise we came up with was, okay, it was that September, you can go, but as soon as, I was only going to play, a couple times. And I think you guys, one of you advised me if I felt anything not to be swinging a golf.
I would say there's very few patients I've had that have actually caused a problem, but it's doing activities, but it's not like they're none. The ones that have had problems have had real problems. We had one lady who became an amateur bodybuilder and ended up having some issues because of overdoing it. I think it's a tough one because people that are really active, it's hard to kind of hold you back.
The one I remember actually was we did one of those deep flap operations, not an implant, but from the ab to belly. We take the tissue and put it on the chest. And the patient was following us on Facebook, and I remember we were both sitting there together, weren't we? and we looked, and the patient was showing, it was maybe 3-4 weeks after surgery. They were at a gym, and they were on the floor doing these rapid crunches, over and over again. And she had posted the video, and we're both looking at this, and we're thinking, didn't we just do this? Yeah. So we actually picked up the phone and actually called and said, you can't do this. This is not going to work.
I think when you go through a surgery like this, I was not willing to have to go back and get something fixed again, so for me.
Patience, yeah.
Yeah, it does test your patience. And I remember, I wound up doing a lot of walking. So after the double mastectomy till July, when you put in my expanders, what I did was walk. And then, I did some light exercises, and I really didn't start doing yoga until maybe a couple months after even the expanders were in. Again,
The final implants, right?
yeah, the final implants. I just didn't really want to have to go back and have any more surgery if I didn't have to. So,
like I said, and we've really been excited to see you be so active in those bike rides. I mean, you're taking these long bike rides and you do it. You mentioned it's through the YSC. And this is an organization that I know a little bit about, but not a lot. And it sounds like you're pretty involved. So can you tell us a little bit about why it's the Young Survivors Coalition, right?
Yeah, it's the Young Survival Coalition, and it was founded in 1998 by 3 young breast cancer survivors out in New York City. Some of them, I forget their ages, but they were all very young, 30s, and they found like they didn't have any support. They go to support groups or whatever, and they're like, yeah, well, they're grandmas or they're older ladies, I don't have anything in common with them. Some were married, some were single. And so that's how the organization got started. And it's really the only international organization that deals with the issues of breast cancer in young adults under the age of 40. I mean, you really kind of, in my mind, the way I look at it is you kind of have to separate. And even though I was 43 at that time, they had it up to 45. They're not booting me out at this point. I'm soon to be, and I have no problem telling my age, soon to be 62.
Oh my gosh, you don't look anything. Well, that's amazing.
It was a great organization. I had young kids at the time and I didn't know what to be telling my kids. And it was just a great way to connect with others. And I mean, there's just so many issues. The way I look at it is you can really divide it into premenopausal and postmenopausal is the way I would kind of do it. But most of the research in younger women, there's not as much research. There's a lot more from when we started YSC back in 1998 going into research for young women and young adults with breast cancer than there was. And their needs are so unique. What do you do if you're a single person, you're working your full-time job, and now you've got to be out because of your chemo treatments, your surgery, how do you continue on? What do you do about if you want to have children someday?
It's a very good point.
With the chemo options, there's an awful lot to think about. I was blessed that I had my 2 children at the time, of my diagnosis. So
you may have mentioned, I may have missed it. How did you end up getting involved with them? Did you find them? And what did that mean to be involved?
Actually, one of your patients that I sent to you just recently, I'll just leave her first name, Anna, I got invited to this group. I got invited to a couple of things right after diagnosis from my doctors. Myself and this other young woman, we were the only 2 in the room. She was much younger than me. She was 32. Anna wasn't there at that time, but this other gal was. And we went to this thing and we're looking around. And afterwards we were like, I don't have anything in common with any of these women, and I have these needs. So we had both talked about, we had gotten an invite from one of the breast health specialists.
Like the nurse navigators?
Like a nurse navigator to go to a meeting. And I was so anti-support group. I was like, I'm not going. I don't want to listen to people, saying, woe is me. And I went and that's where I met Anna and another young woman. And they told me about YSC and, I started to get involved. I've been involved in some other charity things and being a bean counter. Everybody always wants me to be a treasurer of something, which I refuse do anymore. And so that's how I got involved with YSC. And then I was involved with them on a very local level. And then we had our bike riding team here. We've had to change the name. Originally it was Feel My Buckeyes. We kind of changed it. We had like a half hour to decide what the name should be, and that's what it was. And now it's called Rolling Buckeyes. And so YSC had asked me a couple of times to do the bike ride, and I was just like, I am not getting on a bike for 200 miles. And speaking of which, right after I had the implants put in, I didn't do a lot. That was in July. I didn't do a lot of bike riding. I only was out on my bike maybe 10 or 15 times before my ride at the end of October. And so when I went on the ride in California, I pretty much just said, hey, if I get on this bike and only ride 10 miles, that's a great day.
Yeah, that's
so. And I wound up, I think I think whatever sport you can find that can help you mentally, when I got on that bike, I felt like I was getting my life back, and so like the first day out of the 70 miles, I think I rode like 50. The
Wow.
second day, I couldn't ride very much. I rode like 30, because I was sore and I didn't put the training into it. And then the third day, I don't know how I did it, but the third day I rode the whole entire thing, which was 55 miles. And usually I was one of the ones in the middle of the group coming in and watching and I was like next to last coming in, but it didn't matter because, I just felt like I needed to do this for myself. And it's pretty emotional when you set even a small goal for yourself and you wind up doing it. I see women, friends of mine that have done this for the Coleman. They've never run before. And then they wind up saying, I'm going to go run in the Coleman. And then, they do it because, breast cancer can take a lot away from you if you let it. And it does, it does take stuff away. And, people still look at me and go, oh, you look so great, But, I think one of the other things we need to start talking about is long-term survivorship.
Yeah, absolutely. Especially given the therapies that that are being used today, we're seeing obviously the survivorship is quite high in this disease, which is great.
Yeah. And so one of the things I found with YSC is when you go on these bike rides, 35% of the women are either in treatment or through treatment. And it's just a whole weekend where you're with other people who kind of know what you're going through. And then you have, ride marshals who just love to help push you up the hill. And I have to admit, I've had to have them push me. There aren't mountains like they have out in California here in Columbus, Ohio.
And you're doing this with thrombocytosis. I imagine that has some impact, especially when you're in elevation.
It is a little bit on the elevation with the essential thrombocytosis. One of the things is I get more fatigued earlier, obviously because, with the platelet problem. So, after those rides, I pretty much, you're exhausted. But like for me mentally, I can put myself on that, in that box and think about everything I've been through. And before you're done for the day riding. So, and one of the nice things about YSC is they have, especially since it caters to younger women or younger adults, there's more like face-to-face groups. They do a lot of things online. There's actually a Facebook group that they can go to and they can put out that kind of similar to something like you guys have, where people can go out and say, hey, I'm taking this drug, this, and this, what are the effects? So, there's a lot of connectivity with people that are similar, younger women.
In that Facebook group for the YSC, especially in the breast cancer arena, are they talking much about reconstruction, or is it more about treatment?
Oh, yeah, they talk about reconstruction. They talk about deep flap. They talk about just different things like different chemo treatments they're on, how to combat like fatigue or what you did. And sometimes people just go out and post and they just have to vent, like they're not feeling great, I mean, with women, a lot of us, it's about our body image. And then like when you stand there and you look at yourself and you've got like a scar and you have no hair and you're just not feeling like yourself, it's sometimes it's hard to pick yourself up off the floor. And, you could sit there and pull the covers over your head, which I have to admit, I had those days myself, and you just have to find a way to dig in and just do it.
It's very obvious that you have dug in and gotten out of it. You're brilliant. We've been very excited to have you as a patient, and it's been nothing but a pleasure, and we're excited to know you. Yeah, I think this has been great, Patti. I really appreciate you taking the time today to kind of chat through some of this stuff. As we wrap up here, it sounds like the YSC is a great resource. How can our listeners find them online?
Yeah, they can go to youngsurvival.org and they can just go online and there's a lot of resources there. One of the things Young Survival Coalition has also, and one of the committees that I'm on, is actually we also have to start talking about our co-survivors. Those are those around us who take care of us. Like my husband, oh my gosh, my husband was great. I mean, especially with the double mastectomy, helping me with my drains and stuff. YSC not only helps young women and young adults, it's starting to help co-survivors as well. So they can go online and look there, and they have face-to-face groups. So that's that's basically how they can get in touch. And then the Facebook group, I think they can find that online if they look, getting involved in that.
Well, fantastic. Well, thanks again, Patti, and we look forward to seeing you soon. Sounds like we've got some other things to talk about offline, which is going to be great. So you're going to help us hopefully carve out some of our out-of-state travelers and help us develop a great program for them. So thanks for being so involved.
Thanks, Patti.
Thanks for listening.
We hope you found this episode helpful.
Want more info? Connect with us at mwbreast.com.
And go behind the scenes with us on Instagram at MWBreast. Thanks for tuning in.
And join us next week.